and welcome to yet another episode of Africa Talks, brought to you by Indiafrica Today. This is a weekly show where we talk about contemporary issues in the context of India and Africa. And today we are going to talk about a very important issue of the challenges that have been posed by COVID-19 to differently abled people across the globe, and specifically in India and Africa, and whether the governments in India and in various African countries and the non-governmental sector have been able to provide any kind of support that is required at this point of time to differently abled people or not. What is the situation currently in Africa and India? And to talk more about that, I have a very eminent group of panelists today with me. I would like to first introduce Dr. Christopher Navanoro. Dr. Chris, welcome to the show, Africa Talks. Dr. Navanoro is a seasoned diplomat, and currently he is Minister Political at Nigerian High Commission in India. He was previously also assigned to the permanent mission of Nigeria in the United Nations in New York. Dr. Chris, welcome to the show.
You're welcome. Thank you very much.
Our next panelist today is Mr. George Abraham. He's CEO of SCORE Foundation, and he's also the founder of World Blind Cricket Council, and Ashoka Fellow, and a motivational speaker, and a person who has been vocal about disability issues and rights for several decades. Mr. Abraham, welcome to the show.
Thank you.
Our third panelist today is Ms. Callister Chinyere Uguwa-Aniki. She is joining us from Abuja, Nigeria. She is a lawyer by profession, and she is working with the Federal Ministry of Justice in Nigeria. Ms. Callister, I welcome you to the show. Ms. Callister, can you hear us?
Yes, I can now hear you.
Yeah. So welcome to Africa Talks.
Thank you very much. Thank you.
Our fourth panelist today is Mr. Samuel Money, who is an entrepreneur. He is owner of Neutron Computers, and he has been working tremendously for disability rights in the country, and has been widely awarded, has been speaking on several platforms on disability issues. Mr. Money, welcome to the show.
Thank you. Thank you. Thank you for having me.
It's a pleasure to have you today in the discussion, Mr. Money. Our next speaker today is Mr. Foster Addo, who is a young lawyer in the making. He's studying law in India. He's from Ghana, and he's representing Exilient India today in the show. Mr. Foster, welcome to the show.
Yes, thank you very much, Dr. Sorry, Mr.
Great. Friends, we are in the 7th month of 2020, and in the last 7 months, we have been through some unprecedented situations. COVID-19, it's still spreading its wings, it's still there, wreaking havoc in several countries across the globe. And though governments, non-governmental organizations, UN bodies, everybody is working day and night to stem the tide of COVID epidemic, but still I think there's a lot of efforts are needed. A lot more time is required to defeat the COVID-19 virus. During the last 7 months, we have seen that people across the globe have underwent several hardships. It has caused unemployment, migration, health issues, economic issues. And in the whole scenario, the problems faced by the differently abled people have been compounded to a large extent. Due to the nature of this pandemic, their access to healthcare services, their access to monetary resources, their access to caregivers has become largely limited. But have the governments in Africa and in India have been able to focus on the specific requirements and problems faced by differently abled people during the pandemic? We would like to discuss more about that. I would like to start the show first with Mr. George Abraham. Mr. Abraham has been working on these issues for several decades now. And during the pandemic also, he has been getting regular information and calls about the problems that are being faced by differently abled people throughout the country. Mr. Abraham, could you give us some idea what kind of situation is there? What kind of hardships people are facing, especially those who are physically disabled and who have several difficulties in doing their daily work? Mr. Abraham.
Thank you, Naren. I believe India is a very large country with a very large population, and there are various sections of the community, and people with disability form a small part of it. Though I say a small part, in absolute numbers, according to the census of 2011, it's close to 26 million. And that's a fairly large figure. I think the population of Australia is probably less than around about 26 million. So, so that's the size of the population. And however, this is a fraction, it's just a fraction of the total population of the country. So I must say that the pandemic has had a devastating effect on the country. As you all know, there's more than 8.5 lakh people who have been affected directly by the pandemic, and there are close to 23,000 deaths which have happened. And this number is increasing at a hectic pace. In the last few days, I've noticed every third day, you're crossing a lakh, meaning from 7 to 8 lakhs was crossed in 3 days. And in March, when the lockdown was announced, I think a lot of people were caught unawares. People were traveling, people were stuck at home, people were stuck in different places. And people with disability, I think, had a have had a very tough time. I must say the government was very quick to come up with guidelines. On the 26th or 27th of March itself, the Ministry of Social Justice and Empowerment had come out with a detailed guidelines as to how the country and the government should deal with people with disability. And the guidelines was in place. As you know, disability is a state subject. So every state is supposed to be kind of handling this, addressing the challenges faced by people with disability. I'll quickly go through the various challenges that have been faced, as you listed it in your introduction too. In the initial months, the March, April, May, what we noticed was that there's a huge challenge in terms of reaching rations and food to people with disability. And we run a helpline called iWay, and we were getting a lot of calls. And then there were a lot of other NGOs also who were getting calls from people with disability from different parts of the country. And the non-governmental sector was the volunteers and non-governmental sector was extremely active, especially in the months of March, April, May, actually providing food and rations to various various people in different corners of each city of India. We were getting calls on our helpline, and we would put out the SOS on our networks, and then some volunteer would pick it up and say, okay, I would arrange for food for A, B, and C. So food turned out to be, and rations turned out to be the first challenge. And unfortunately, the government was caught napping at that point of time, because the helpline that the government was kind of offering the helpline was kind of, there's a 1075, and there were several numbers that were advertised, but those numbers were not actually reaching anybody. So it was, nobody was picking up the call. Like, we got several calls from Maharashtra, Tamil Nadu, Karnataka, where the helpline, though it was advertised, people were not there to receive those calls. So at a time of stress, when people don't answer calls, it is very disappointing.
Yes.
So food was one area. The second area is finance. A lot of people with disability, the government has a pension scheme, and during the pandemic, the finance minister had announced that the first 3 months, 1,000 rupees would be added to the pension that was being given to people with disability. But unfortunately, I believe this pension was only for those people who had disability certificates. And I was reading in a report that was published by the NCP-EDP that only 28% of people with disability in India have the disability certificate. So that is a kind of a big disappointment. And in many states, though the pension was promised, it did not quite reach the beneficiary, because the beneficiaries were expected to come to the government office and collect it. And in this pandemic situation, it was travel is also difficult. I believe Kerala was one of the few states where the pension was actually dispersed. And the third thing is livelihoods. A lot of people with disability actually lost their livelihoods because when you talk about visually impaired people, a lot of them in Maharashtra and Karnataka and so on were actually earning their livelihoods by hawking, street hawking, or selling their wares on trains and so on. And with the pandemic, they were housebound, and there was no way their earnings were completely crippled.
Yes.
And that was livelihoods. And then when it comes to healthcare, there are disabled people also who have diabetes, people who have other health complications. They were finding it difficult to get medication, get to the hospital. And then, as you very rightly said, caregivers, again, because of the lockdown, caregivers were not able to go to the people with disability to provide them with support. And then, even in places like Delhi and so on, to move around also you needed passes. And the government was issuing passes for emergency services, essential services. And if you have had health issues, you could get these passes. But a lot of people with disability did not know where to get the passes, how to get the passes. In fact, I was trying to go to Delhi from Noida, and I just didn't know where to get the passes from. And I would like to make one more point, which is that though the government had put a lot of things in place, like the guidelines was in place, helpline numbers were in place, the people at large did not know what was being done. There was huge ignorance. There was no awareness as to what could be got from.
Yes.
Some people, of course, who had access to television and radio and so on, probably got some information, but there were a huge number of people who called us who had absolutely no idea where they could get help from.
Okay.
So
I think
that's
a very relevant point you have said, Mr. Abraham. I think the information and communication gap further compounded, the lack of adequate government response during the lockdown. And we'll come back to you on this point again.
Sure.
Going to you, Mr. Samuel Money. If I ask you, how would you like to describe the last 4 months, 5 months period of fighting COVID-19? What were the main challenges for a differently abled person during the lockdown, and how the government agencies or the non-government organizations were able to come forward to provide any kind of support in terms of helping the differently abled people in the city?
Well, thank you. I would agree with George to a very great extent. As you know, I'm a entrepreneur, and my wife also has a NGO where we try to bring out people who are living with multiple disabilities. The main problem was rations. At first, it was rations and money for their medicines. Then I also have an experience. Means one of our members also had an experience of COVID. Her whole family was diagnosed to have COVID, and she was taken to isolation place which was not accessible. A person on a wheelchair, not accessible in terms of having a wheelchair or even having a accessible toilet. So she was in a fix, she was facing the illness, and she was also not able to live there because it wasn't accessible. So we had to approach many people and uh, get her to a place where at least the bathroom was accessible.
Yes.
Food issues, rations, like George said, rations were being made available to many people. We also have in bridging the gap, but unfortunately, many people have lost their livelihood, and now they are not even able to restart again, because to restart they need money, and they don't have money because they spent all their savings on during the 2 months of total lockdown.
Yes. I think, Mr. Mani, you have very rightly pointed out the challenges, particularly in the form of livelihoods, that people with different kind of disabilities are facing now when the lockdown is over, because they are not in a position to restart the activities they were doing earlier. Even in the recovery phase of COVID-19, which is going to be a long drawn process, I think this is going to be a huge challenge for disabled people, and I think government must focus on this particular aspect in the coming months also. Coming to you, Dr. Christopher Nanoro, you've heard our two panelists talking about the problems that are being faced by differently able people here in India. I would like to get some insights from you. What kind of situation is there in Africa, particularly in your country, if you can provide us some insights on that? And what kind of support from the government and from outside government, the independent agencies have been able to provide to differently able people there? Dr. Chris.
Thank you very much. It's really a pleasure being in this platform to discuss these challenges faced by differently able people in Africa, especially my country, Nigeria, where I come from. Nigeria is a big country of about 100 million people. And Nigeria has the largest population in Africa and the largest economy in Africa too. Nigeria always sets a pace when it comes to issues and challenges that is facing Africa. So in the issue of COVID-19, before I go into that, and we have approximately 27 million people who are differently abled in Nigeria. So that is the population of differently able people in Nigeria. In Africa as a whole, we have a lot of people which I might not be able to give out the figure because of the census issues that we have when it comes to enumeration of numbers. So we are saying that Africa, Nigerian government in particular, is doing a lot to see how they will help people, differently able people, to cope up with COVID-19. COVID-19 in various of Nigeria assist area, and out of that assist states, we have FCT, where the capital is situated, which is in Abuja. And we have geopolitical zones. For some of you who have not been able to know more about Nigeria, we have 30 states of the Federation and 6 geopolitical zones, the Northeast, Northwest, North Central, East, West, and the South zone. These are the zones we have in Nigeria. So, and in these states, the Nigerian government have been doing a lot to see how they can help people living with disabilities or vulnerable people, as we call them. So government, recently, it's not long that Nigeria signed an act to form a commission for people living with disabilities to give them the rights in order to live independently and to enjoy the benefits of the government. So, and in various states, governments have been doing their best, starting from FCT, the Federal Capital Territory, which is in Abuja, to ensure that palliatives given to people living with disabilities, and all these states are doing a lot of things to assist people with disabilities. Secondly, there have been awareness campaigns, advocacies going on in various quarters to ensure that people living with disabilities are well informed when it comes to issues of COVID-19 or coronavirus, as we call them. So the people have been informed, especially able people, so that they'll be able to cope with the pandemic. Some organizations and NGOs have been doing a lot too to assist the government, because the government cannot do it alone. The government is doing a lot as far as Nigeria is concerned. That is applicable to other African countries, in Ghana, in Congo, in of Africa. They are doing a lot, but Nigeria is doing so much to assist our people, differently able people, to cope with this. So organizations also like CCD, Citizens Center for Citizens with Disabilities, they are doing a lot. My organization, local initiative for the blind, national a lot recently.
Dr. Chris, I think there is some internet issue there. Yeah. Dr. Chris, I think there is some internet connectivity issue there. We can't hear you. Yeah. So we'll come back to you again, Dr. Christopher. We'll come back to you again. We would now like to go to Ms. Callister. Ms. Callister has joined us from Abuja, Nigeria. Ms. Callister, can you hear us?
Yeah, I can.
Yes. Yes, Ms. Callister, you have been working for making the disabled people, all the laws more inclusive, the society more inclusive in general for people with different kind of disabilities. How would you like to describe the scenario in Africa, particularly in Nigeria, during the last 5 months or 6 months when the COVID-19 started spreading in different parts of Africa? Yeah, Ms. Callister.
Yeah, I heard part of the question, but the start of it, the network cut part of it.
Yes, I'll repeat myself.
I heard from. All right.
Yeah. So what kind of situation is there in Nigeria? How would you describe the situation when it comes to the condition of differently abled people in COVID-19 pandemic in Africa?
All right. Okay. Yeah. Indeed, I'm glad to be part of this. And I would say that I may not be able to answer perfectly well because the lockdown locked me up here in Abuja so that I could hardly relate very well with colleagues, with persons living with different disabilities here in Nigeria and in Africa. However, I can say that it has not been easy with persons living with disabilities, as we call them here, in Nigeria and in some African countries where I have been in touch with some colleagues, like in Ghana, Tanzania, in Cameroon. Our people are not finding it easy at all. Here in Nigeria, especially in the cities, like Abuja and some states in the east, where I had enough contact, I've been in touch with a number of persons with disabilities in some of these areas. In the cities, the government tried to do a little but I will give the greater portion of the kudos to non-governmental organizations. For instance, here in the capital of Nigeria, Abuja here, so many non-governmental organizations, organizations of persons with disabilities, and organizations for persons with disabilities really did a lot or are doing a lot to alleviate the sufferings of persons with disabilities. Lots and lots of palliatives, foodstuffs and sanitizers and face masks donated by different organizations like that. On the part of the government, like the central government here in Nigeria, I would say they've been promising palliatives, but we've not really seen them in action. But the states, like Dr. Wanoro said, a number of state governments have really been doing well in trying to reach out to persons with disabilities. But unfortunately, most of them concentrate on the cities. Well, we know that the larger number of persons with disabilities here in Nigeria and in many other African countries live in the rural areas. And because of the lockdown, it is not everywhere that the palliative is announced to be shared that people can move out to get to the place. It is difficult to move around like that. Ordinarily, movement is not an easy thing for a number of persons with disabilities, depending on the type of disabilities. For instance, a blind person at this time, where social distancing is the order of the day, or even a person on wheelchair, all persons with disabilities who need assistance of others to move about are in danger of stagnation, because even when such a person summons courage to choose to eat food, to have food on his table, even if COVID was coming to kill him, the assistance, the person that should assist the person with disability might not have the courage to come out to help because of the contagious nature of this COVID. Yes. Everybody is afraid of one another, as if once you get close, you catch the disease. And so people with disabilities who need assistance don't find it easily. And these palliatives don't get to their doorsteps. Again, yes, because of this challenge of undevelopment, most people live in rural areas where you cannot even identify any house because the houses are not numbered, the streets, no names to any streets. You describe by mango trees, somewhere, you come behind the mango tree, you'll see one blue house, by description like that, and not many have the courage to go searching for such in this kind of COVID era. And yes, so it is pretty difficult for persons with disabilities. We have not even talked about those ones who live on the streets, begging for alms, feeding on what they get from streets on daily basis. Though we don't support that act, but if that becomes the only option for such people to survive, then we have no option since we cannot provide decent jobs for them. But this yes, time, COVID has forced such people out of the streets. And so it is a terrible situation. However, we hope
yes, I fully agree. I fully agree with you. I fully agree with you, Ms. Calista. Particularly the point that you have raised, that the difficulties for people living in rural areas, people who are homeless and who are disabled, I think for them it's a terrible time. And for them, the problems are really, they have been aggravated by COVID-19. And for government, it's not possible to reach out to each and every person, especially in inaccessible areas, in rural areas, where it's difficult to identify people, it's difficult to identify homes. I think that's a very valid point you have made. Coming to you, Foster Addo, we would like to know your viewpoint on the issue that we are discussing today, particularly if you can share something from Ghana, the country you come from.
Yeah, sure. Thank you very much, Mr. Rao. So looking at or hearing from my senior colleague and Mr. George Abraham and everyone who has given their submission, I find this very like these three things the main problem when it comes to people who are differently able. That's one, lack of inclusiveness, then lack of accessibility, then availability, then mobility. So Mr. George was talking about government came out with guidelines to support people with some kind of disability. Now, the same thing happened in Ghana. In Ghana, the government allocated certain amounts from the COVID-19 fund to support people who are vulnerable. And these vulnerable people includes people who are differently able. Now, the main problem was the guideline and everything, the intention was good, but however, the implementation was not really done properly because people who are differently able were not able to access this information. They didn't even know where to go and get some of these essential items that were being shared to them. And mind you, me, for instance, as in fine, during the lockdown, I would be able to move out to go and get something. But considering people who are differently abled, mobility becomes a very a very massive challenge for them. So I think the governments and institutions who are responsible for COVID-19, for people who are differently abled, they should have records. Proper records should be collected to know each and everywhere people who are differently abled are, so that when it comes to dissemination of information, it should be done. And also dissemination of information should be made in such a way that it will get to people who are differently able. For example, when the government institutions were giving out public health information to fight COVID-19, we had sign interpreters who came out, who were employed to also interpret what were being said to fight COVID-19. And also, Madam Callista made a point that most of the people who are differently abled live in the rural areas, and it's very difficult to get to the rural areas in normal times, not even to talk about during COVID-19 era, whereby lockdowns were imposed and everything. So I think accessibility should be looked at, availability should be looked at, and also mobility should be looked at. How can we include people who are differently able in making these policies? How do we get information that's life-saving information accessible to them? How do we do it? So these are some of the questions that we need to ask. And if we are doing them, maybe then the government institutions and other non-governmental organizations needs to do more in order to fight these challenges.
Yes. So the government and the non-governmental organizations needs to do more to fight the challenge. As per WHO, Mr. Abraham, as per WHO, 15% of global population has some kind of disability. Globally, there is almost a population of 1 billion people who have some kind of disability. That's what WHO data says. it's almost 7 to 10 months that this outbreak happened last November in China, and it spread all over the world. How do you see, and what would you like to suggest to the governments and to the non-governmental organizations, that how they can ensure that in the road to recovery, which is the post-COVID phase, how to ensure that the issues of differently abled people are a part of the recovery plan, are part of the entire procedure that is going to be followed for recovery from COVID-19 challenge, because the recovery is going to be a long drawn process of several months. How they also need to specifically focus on the rights and the needs of differently abled people. If you have some specific suggestions for the government and for the civil society groups for the coming months or for next 1 year, that they can implement on the ground for differently abled people.
Disability is a cross-cutting issue, meaning whether it's education, whether it is health, whether it is livelihoods, whether it is transportation, whether it is any section of governance. People with disability are kind of stakeholders. So and unfortunately, the way the government functions is that government has created a Ministry of Social Justice and Empowerment, which is
Sorry. Yes.
They have created this ministry, and as a result, the Ministry of Urban Affairs, the Ministry for Transportation, Surface Transportation, Ministry for Civil Aviation, Ministry of Finance. For them, disability issues don't come as top of mind or as a priority. And as I said in the beginning, the first time around when I spoke, that the nation is huge in terms of numbers, in terms of area, in terms of diversity, in terms of climate, in terms of challenges that each geography kind of offers. So the hands are full. And I believe, first of all, I think the government should start looking at the planning process which is inclusive, where people with disability are included in the planning process. Because often what happens is that when government puts things down, it's done by uninformed people. People do not know. Like, for example, the Arogya Setu was launched. The app was launched a few months ago, and the initial stages, the app was totally inaccessible. People with vision impairment could not use it on their own. People with hearing impairment could not use it on their own. And there was a lot of noise made, and the Ministry of Social Justice and Empowerment then took it up, and the Ministry of Electronics and IT kind of did some tweaking. And I believe right now the app is accessible. That's what people who have used it have said. So this is a kind of feature which goes across the board. Everything is designed by people who do not know very much about disability, who are not conscious about disability, and as a result, as a gentleman from Ghana said, accessibility becomes a major issue. So going forward, I would say, number one, I think the planning should be inclusive, where people with disability should be part of the planning process. Disability activists should be involved in planning out the action forward. Number two, I think going forward, the country has a tremendous opportunity to restart a few things. Like, for example, education. Education has become online. A lot of courses, a lot of universities and schools have all gone on to the online mode of education. And this is a very great opportunity to actually start people with disability also on online mode of education. And therefore, when the designing happens, I think it's very critical for the designers who kind of roll out these education capsules and programs. They need to kind of be conscious that people with disability are going to be part of the system, and therefore what they do needs to be made accessible in design, so that a person with vision impairment, person with physical disabilities, people with hearing impairment, they are all able to kind of use and participate in this whole thing. The country has a great opportunity to redesign things because the whole thing has been disrupted as of now. So that is a great opportunity the country has, in fact, both at the urban level as well as at the rural level. Then the other thing I would like to state is that, this whole thing about accessibility. Now, financial services, right from the time India went digital, I felt it was a great opportunity to include people with disability, especially people with vision impairment and hearing impairment. But unfortunately, again, as I said earlier, the software engineers and the IT professionals who are involved in the whole digital process have not really understood the needs of the entire population. And as a result, a lot of digital platforms that have come up have become inaccessible. So I think the key operative word is include people with disability in the planning, and everything that we design as we go forward has to be accessible. And the other thing is the health services. Now, there is, we are talking about what could happen in future. Now, jobs are few. Employment is an issue. Livelihood is an issue, as Sam said, as some of the others also spoke. I think there needs to be focus on entrepreneurship. I think the government and the private sector and the NGOs need to look at encouraging entrepreneurship amongst the people with disability. Right from the school-going age, I think the idea and the mindset and the skills required for entrepreneurship should be included in the education and the training processes that are coming up, so that more and more people with disability can look at entrepreneurship as an option rather than looking at jobs. Because right now, the jobs are only in the government sector. They are reserved jobs. Private sector hardly gives any jobs to people with disability. So entrepreneurship, to my mind, is a very practical option. And I think that's the mantra for tomorrow.
Great. I think that's a very important point you have made, enhancing the entrepreneurial skills of people with disabilities. I think that's a very important point coming from Mr. Ibrahim. Coming to you, Mr. Samuel Money. Mr. Money, if you could suggest some specific, suggestions, if you can share, how to ensure that people with disabilities are part of government's response and recovery process.
I think George sir has given wonderful ideas, and I think the only perspective that I would like to bring in is, like, if you are encouraging entrepreneurship in disability sector, you should also give them opportunity in terms of getting whatever they're doing, to encouraging them, not only by just giving them a soft loan, but also helping them in by way of giving them orders, because marketing and how to deliver their services or their products is also a part of entrepreneurship. And for this reason, I think everyone should concentrate on, in India government has said that now they will concentrate more on giving orders to companies which are Indian-based companies. I think this will also give some orders to entrepreneurs who are with disabilities. That will give encouragement to them.
Yes.
Secondly, As George said about the education system and about including disability in every area of planning. I think when you include it in every area of planning, you will automatically remove many of the hurdles. And also, you should also give accessibility tools like wheelchairs, laptops, even mobiles to encourage online education for visually impaired people. They require special software. If their availability is made easy, then I think more people will be able to access the facilities.
Yes. I think, Mr. Mani, you have made a very valid point that this digital divide, which is there in terms of accessibility, needs to be filled in. This digital divide has to go if we really want to develop the entrepreneurial skills of people with different abilities. Coming to you, Dr. Christopher Navanoro, would you like to make some specific suggestions which government and the independent non-governmental agencies needs to take into consideration in the coming months to make sure that the basic health services and the basic life-saving services are provided to differently able people in the post-COVID recovery phase?
Yes, there's need for more sensitization, awareness campaigns and advocacies to be carried in various areas to ensure that information gets to the grassroots, gets to differently able people, to ensure that they will be able to be carried along in the scheme of things. Information is power, because sometimes some people are not fully informed, they are not enlightened, they don't get real information, so they wallow in darkness because they are not getting the right thing. So information and seminars and conferences, advocacies need to be expanded to ensure that our differently able people will be fully informed when it comes to issues like this. Is that the governments of various countries, especially in Nigeria, they have to look into the policy making, ensure that people with disabilities or differently able people will be carried along. Policies should be made to carry them along in the scheme of things, because most times there are policies that are not friendly with people with disabilities, especially when it comes to accessibility, mobility, transportation, and otherwise. So there's need to put these things in place so that in future, maybe in the post-COVID-19 era, people will be fully informed. So for the NGOs too, the NGOs need to do more to get to the grassroots, get this information, put it across to the government and the non-governmental organizations and some international organizations who are assisting differently able people to be able to cope favorably in the country or in the places where they are, in their workplaces, and those who doesn't have work, those who are independent or who did one skill or the other. So these people need to be informed. So government have to cut them along. So these are the areas that I think more things need to be done to carry everybody along.
As Dr. Chris has pointed out, the policies that are being made needs to be more inclusive, needs to have people from this sector who can talk about the problem they face every day in their lives, and those problems and the solutions can reflect in those policies. Coming to you, Ms. Callister, what suggestions would you like to make for the government and other agencies to help the differently abled people in the coming months?
Yeah. First of all, before I make my recommendation, I want to state that there's a step that the government of Nigeria took recently that has given persons with disabilities in Nigeria and of Nigeria a little hope. The government set up a committee that they say should see to the development of Nigeria in the next 5 or 7 years or so. And a person with disability, a prominent person with disability who has fought very vigorously to ensure that the Disability Act, as we call it here, that was recently passed and assented to by Nigerian president, was successful. One, David Anyele, the executive director of a center, I call it Center for Citizens with.
Yes. Ms. Callister, can you hear me? I think there is some connectivity issue there.
No problem there.
Ms. Callister, can you hear me? Okay, we'll get back to her again when she joins. Coming to you, Foster, last points from your side in terms of specific suggestions or recommendations.
Yeah, sure. So with regards the recommendation, I would like to recommend that there should be inclusiveness, as I mentioned earlier on. When making policies for differently abled people, we should include them to know what's actually their challenge and what how things can be done to help or to support. And also we should have digital accessibility. Now information provided should be in accessible formats like brailles, like how do I call it, sign language interpretation. Then we have the captions, audio provision.
That committee now will bring about.
Oh, okay.
Callister, are you back?
Ms. Callister.
So, hello. Okay. Okay. So, as I was saying, yes, we should have all these variable methods of ways of disseminating information to make it accessible to differently abled person. And I also believe that digital education and technology is the way to go. Like, it can really bridge the gap and bring a new experience of immersive training to people who are differently abled. It will really go ahead to make their day in and day activities very, very easier. And as Mr. George was saying, he said something like people who are differently abled should be trained right from school-going age in a form of like, we should use digital education to train them so that when they grow up, like it will be with them, right? So we can take the advantage of technology and as an equip and empower people who are differently able to become independent on their own, not necessarily needing other people to help them, because this is something that is their right. Like, yes, according to the 2030 Sustainable Development Agenda, it's emphasized that disability shouldn't be something that should curtail the rights, the human rights of persons. So I think this really needs to be looked at. And going forward, I think with the help of technology again, we can use text-speech technology, then speech recognition apps, then aids, on-screen text, Braille, as I said earlier on, Braille converter. We can look at all this opportunity, right? And we can help and support differently able people in a way of empowering them and to become independent on their own. And also, Mr. George said something about entrepreneurship. So going forward, I would like to say that the entrepreneurship should be incorporated in the form of we should incorporate technological education in the entrepreneurship. When we look at the trend, COVID-19 has changed the world totally, and we are all going digital. Looking at online sales, now we are ordering everything online. We are doing everything online, so we can train people who are differently able in this line. We have certain skills like online marketing agents. We have analysts who are working online. We can train people who are differently abled in this area, in this sector, to empower them and make them independent on their own, not necessarily.
I think that can open new opportunities. Mr. Foster, I think that can open new job opportunities for them. You are rightly pointing out that. Coming back to you, Ms. Callister, there was some internet connectivity issue. Last point from your side, a few specific suggestions you would like to make for government and for all those people who want to work for the rights of differently abled people.
Yes, for the government, I want to say that the government should increase the steps it has taken by showing that it intends to include persons with disabilities in its governance. For instance, I was referring to a committee formed by central government of Nigeria to work towards development of Nigeria in the next 7 years. And a person with disability was appointed into that committee, a person that all persons with disabilities in Nigeria know that has worked very hard. And we believe that he will represent us well. But just one person, just one committee will not do. So we need inclusion, because no one can tell the story the way the victim can tell the story. No one who is not wearing the shoes can tell that the shoes are pinching him here. So, and then coming back to our own people, we need to work hard to develop ourselves so we can stand up and challenge anyone to take our rights, because sometimes these rights are not easily got. You have to fight sometimes to get these rights. And if we talk and it's not given, when we are qualified, when we package ourselves very well, then we can stand before anyone and take our rights. And so even homes, families should do well. Families with persons that have persons with disabilities, members with disabilities, should do well to give support so that these members will be very well packaged, even if it's not formal education. Like I think Mr. George or Samuel said, the entrepreneurship will help a lot as the world is changing from the former style of living. The COVID has brought some good aspects of life, teaching us that we have to be flexible in life. We have to be dynamic. It is no longer the way it used to be. And so everyone has to be innovative, find a way to get out of the quagmire we have found ourselves. And COVID, I think, indeed, yes. I see COVID having a positive, because it has come to unveil the inefficiency of most of our governments. Exposed. It is for persons with disabilities and all working for persons with disabilities to take up the challenge to step into any corner, any office, any stage where those things are hidden, where those rights are hindered from getting to the rightful owners. We have to take up our rights and enjoy it.
Yes, I think Ms. Callister,
nature has given us.
I think we would like to end this program on this very positive note that you have said, we have to ensure that we take our rights and we enjoy it. I think that's a wonderful message for everyone.
Naren,
I think, Mr. Abraham, last point.
Just one quick line.
Yes.
The COVID has come, they have dismantled, it's devastated the world, but it's also given us the opportunity to have new beginnings.
Of course.
And I think we should look at new beginnings. And I think a lot of that has been said in this program: digital empowerment, digital platforms, entrepreneurship, and all that, to my mind, augurs well for the future if the planners and the people who run the country can take them on board.
Definitely. Definitely. I think the point you all raised about making the whole policy making process more inclusive, providing entrepreneurial skills, digital empowerment, enhancing their accessibility to latest technology, and the last point which Ms. Kalista made, we have to be innovative. So I think these are the points that can make a new beginning. As Mr. Abraham said, we can start reconstructing a new system which can be more inclusive and helpful, and where the people with different with different kind of disabilities can exercise their rights in a more meaningful and in a more productive way. So thank you so much, Mr. Ibrahim, Mr. Samuel Money, Mr. Foster Addo, Ms. Kalista, Dr. Christopher, for joining us today. It was a wonderful discussion, and I look forward to have you again in some of our future programs. Viewers, thank you so much. Thank you so much for joining us today on this Sunday evening in this episode of Africa Talks. We'll be back again next week, 8 o'clock, with another important issue and with a group of very eminent panelists to discuss and share their views. Thank you so much, everybody. Good night and goodbye.
Good night. Thank you.
Good night.
Good night.
Good night.